Dr. Cruickshank was responding to a caller who reported that two elderly friends had to wait 2 days at the A&E before they were seen.
Yes, we do acknowledge the waiting times have been protracted recently, but when patients are seen, they then have to be seen by the doctor. They have to get all their investigations done. They have to wait for those results. We have to refer them to specialties to be seen, and then they may have to be admitted, which might take a little while in terms of the beds on the wards. So it's very easy, yes, to be in accident and emergency for 2 days as you're processed along your treatment path.
The focus of the program was the QEH responding to changes in healthcare. Dr. Cruickshank says an increase in emergency cases is also contributing to the delays.
Yeah, we are seeing quite a lot of emergencies at the moment. Cardiac arrest, respiratory arrest, trauma, stab wounds, gunshot wounds, and also emergencies related to the chronic diseases that patients are not taking care of themselves properly and therefore presenting to the accident and emergency department quite ill. These emergencies take up a lot of our resources. They take up a lot of our medical and nursing staff, personnel, because we have to attend to them immediately or within a short period of time. And as a result of that, it does delay the time that we can get to other patients.
And Chief Operations Officer and Acting Chief Executive Officer Dr. Christine Greenidge has shed more light on the abandonment of elderly relatives at the facility. She says sometimes there can be more than 30 elder for care patients at the QEH.
We see these people crying, I have a house, why won't they take me back home? I want to go back home. Not every one of them have dementia. Many of them are of sound minds, and they have expressed that. So something has gone very wrong in our society. Certainly as a child, when I grew up in Barbados, the village took care of elderly. It was something that we just did. Everybody pitched in and took care. But we're seeing this phenomenon now that literally and interestingly, if we look at the demographics around, it's very seasonal. So we start to peak during crop over time, and it steadily increases towards Christmas.
Wow. Efforts, however, are being made to address this congestion, including medication with the hospital pharmacy reportedly dealing with 500 to 600 patients daily.
Now you can imagine that that's quite a burden for the pharmacists, and if there are any staff shortages, that becomes even more of an issue. So instead of persons leaving their homes, perhaps catching 2 buses to come to the hospital and wait for an extended period of time to get their medication, you can simply call our dedicated delivery hotline, or if you're tech savvy, you can go on the hospital's website and you can order your medication and have it delivered straight to you.
And hospital officials want Barbadians to be aware they can avoid long waits for their medication delivered for what they say is a small fee. Ryan Broom, CBC News.